Hello, welcome to the October edition of Critical Care Medicine's video. I am extraordinarily pleased to have two experts with me, Doctors Amy Dzierba and Erin Barreto. Amy is a member of the executive committee of the Society for Critical Care Medicine, and Erin is an associate editor for the journal. The article that we will be not discussing, but referencing here is the effect of comprehensive medication management on mortality in critically ill patients by Sikora and colleagues. And again, I'm fortunate to have two board certified critical care pharmacists with me to talk about the role of pharmacists in the ICU. And that leads me to my first question, which is how does a critical care pharmacist add value in the ICU? Dr. Dzierba, do you want to take that to start out?
Sure. Thank you, Dr. Sevransky, for having us on this podcast today. Um, I think first and foremost, probably the way you think about how does a critical care pharmacist add value to the ICU is through direct patient care. There's so much that a pharmacist can do in this space, being part of the multi-professional team within the ICU, whether that be proactive medication selection and dosing. Oftentimes, these patients suffer from different organ failures, such as the kidney or the liver. There's certainly PK, PD aberrations that the pharmacist takes into consideration when selecting a dose to personalize that dose for the patient. Whenever possible, therapeutic drug monitoring might also inform the pharmacist in how to make sound recommendations of either changing the dose by increasing it or decreasing it. And of course, sedation and analgesia is probably in everyone's rubric of ensuring that patients have their sedation appropriately stopped every day in appropriate patients, waking them up, doing spontaneous breathing trials, and also selecting the right type of sedation for that patient. I've certainly just touched on a few, so I'll pass this over to Dr. Barreto to continue the conversation.
I agree with what Amy said. I think a lot of the work that a pharmacist does every day is trying to step beyond the black and white into the gray and facilitate ways to individualize pharmacotherapy. I mean, it's very easy to read a guideline that says, do this, do that. But we all know that when there's a patient in front of you, it just doesn't usually pan out that way because of the patient's circumstances and the end organ dysfunction and the drug interactions and all the things that Dr. Dzierba mentioned, but also because there are extenuating circumstances, formulary, shortages, pandemics, whatever it happens to be. And so I think that individualizing pharmacotherapy is really at the center of what a critical care pharmacist can offer, but it is certainly not the end. And there are nice consensus recommendations out there and many, many papers that talk about how the pharmacist can partner with the critical care team in all facets of critical care medicine, whether it be education, quality, research, policy, infrastructure. All of those things are areas where pharmacists can add value. And certainly there is a number of studies out there talking about that. As a representative example, I know of at least one paper very clearly off the top of my head published in Critical Care Medicine looking at how a pharmacist can improve bundle adherence for a variety of different interventions, including things that are often not pharmacotherapy centric, like removing lines. So there's lots of different ways that pharmacists can be involved in creating high quality care for ICU patients, including individualizing pharmacotherapy, but all of these other pieces.
Thank you. And that's a wonderful segue to my second question. Both of you have spent time at the bedside with patients, but you also have other skill sets. So, starting with Dr. Barreto, can you talk a little bit about some of the other things that training as a critical care pharmacist might allow you to do?
Sure. I think most of the contemporary critical care pharmacists that are coming out or have kind of come out in the last decade have advanced training across these various buckets that I just mentioned. So I'm going to just take the pocket of research since I'm representing the journal team and suggest that I think that just as we imagine that on a critical care team, a pharmacist is an integral member of the team, and I think the society embodies that belief wholesale. I think that there are a lot of research teams who are studying pharmacotherapy interventions in critically ill patients who do not include pharmacists. And I'm always left to wonder why that is. But I think that it is an opportunity for pharmacists to get more involved. So I guess this would be a pitch to people who are doing research or are doing quality to consider why, if you wouldn't practice without a pharmacist, why you would do research or quality without a pharmacist on a pharmacotherapy topic. Because I think that they have the training and the expertise to add value to the scientific team. And I think oftentimes it is simply just not a thought that people have in their head or a lack of awareness about the role that a pharmacist can play on a team like that, or an absence of familiarity with people who do that work. And so I would certainly encourage people to ask around and try and identify those partners to try and improve the multidisciplinary teams that they bring into all of these other pieces of their critical care experience.
Dr. Dzierba, what would you add to that?
Yeah, I think there's a lot of opportunities where pharmacists can also situate themselves into leadership roles within societies, and that can be multifaceted. It can start at the committee level, it can start at a task force level, and that could be being a member to being a chair or co-chair of a particular project. There's also the opportunity for pharmacists to get involved in guideline development. I think that the society does embody, including a multi-professional approach when developing the authorship for guidelines so that every aspect of the guideline is taken into consideration. There are certainly sections. There is the clinical pharmacy and pharmacology section for which there are a number of leadership roles to get involved in. And should you be fortunate to move on at the society level, also get involved in council and then executive committee if that's something that interests you. But what I really appreciate with the society, and the society has always been my professional home, is that multi-professional approach where everything the society does, there you will see a nurse, a physician, a advanced practice practitioner, a pharmacist, so that, again, you're looking at the holistic approach to developing a product that makes sense to all the different professions.
Can I add one thing to that? I think one thing that Dr. Dzierba mentioned and that I think is part and parcel with this conversation is how we train the workforce of the future. I think especially given the constraints being put on clinicians to do more with less and the need to care for more complex patients every day, I think pharmacists can be really integral in bringing a level of expertise to offload some of those other team members. And if we can ingrain that in our trainees, pharmacy trainees, therapists, respiratory therapists, physicians, advanced practice providers, if we can teach those individuals about the value of pharmacists very early on, then those people, when they get to the C-suite, can provide compelling rationale to places who don't currently have that resource and can kind of help escalate it into the conversation. So I think education, policy, and kind of the structural pieces, I think, is a huge opportunity that we have as we look at the workforce of the future.
I think what's so important too is not always do pharmacists get trained in this space. And so it's also looking to who were in these positions before and getting that mentorship very early on.
Well, it's been my great privilege to talk with Dr. Dzierba and Dr. Barreto about the role of pharmacists in the ICU. And if you're interested in learning more about how they might affect patient outcomes, please go to the October issue of Critical Care Medicine to look at the effect of comprehensive medication management on mortality in critically ill patients by Sikora and colleagues. Thank you all.
you.